Hello, everyone. My name is Priscilla Walker, and I'm the acute care educator here at West Georgia. We decided to make a video to help you guys locate where to document heart failure education and how much time we spend providing education, just with our COVID numbers increasing and to make it more doable for the staff to get the education that they need and then also to prove competence. So we will have this short video and then there will be a quiz to follow just to make sure that everyone is getting the information that they need and that they'll be successful with this. Our heart failure education goal is 60 minutes for every patient that comes in with a diagnosis of heart failure, whether that be an exacerbation or if it's a new diagnosis for them, they must receive the 60 minutes from the time that they arrive to the time that they're discharged. So education can come from physicians, it can come from the nurse practitioners, it can come from the bedside nursing staff. So if you look in your physician notes and you see that they have documented heart failure education, it has to specifically say heart failure education provided and how much time they spent doing that. Otherwise, it does not count. So if they have already documented 30 minutes, that would leave the remaining 30 minutes for the bedside nursing staff to cover. So we need to know where to document that so that it's easy to extract and that we're covered with our goal. Okay, so the way we're going to do that is by using our heart failure discharge readiness checklist. So once you come into your patient's chart, you do have to go to flow sheets. And once you get a flow sheets, you do have to wrench this in. It's not one of your primary topics that you can select across the top. So you'll type in heart here, hit enter, and it is the top choice that comes up. It's HF Discharge Readiness Checklist. You just hit accept and it brings you to the flow sheet. This is a lengthy flow sheet. However, for the purpose of this training, we're focusing on education and time spent. So you do scroll down to the yellow section here where you see those topics listed. You can see here that someone has already documented some education. They've documented what they taught the patient about and the time that they spent. You can also scroll back and see what has been taught previously so that you know that we're teaching them new topics and to be able to add up our time pretty easily and see how much time we have left to provide. Of course, if a patient has already received medication education, that's not to say that we can't provide more education if they express a concern about that or they need further education for that. We can still document, again, medication, but we do want to try to touch on all the topics if possible. So to demonstrate how to do this, I'm just going to insert a new column for us and then scroll back down. So when you click here for heart failure education topics covered and you select the magnifying glass, it does give you the options here at the top. 30 minutes of this education must be face-to-face with the nurse or the provider. And then the other 30 minutes can be videos. However, right now, the only people that have access to the videos is the sixth floor staff, and that's because they have the MyChart tablets where they're doing our pilot for that. It is our hope that they will have those available on all the units soon, but as of right now, sixth floor can do 30 minutes of videos and then 30 minutes of face-to-face, but the other units, we just need to meet our 60-minute goal, okay? So you see here at the top all the choices, and then if you scroll down, you'll see the videos if that's an option for your unit, and you'll see how long they are worth, okay? So we'll just select follow-up appointments. We'll talk to them about that and how important those are. And then we have to put the time. If we don't put the time, it doesn't count towards our goal. So we've got to have the time there. So we'll say that we spent 8 minutes talking about follow-up appointments with them. Okay, so that's adding the education and the time spent. That's all that we have to do. We just have to make sure that we're meeting that 60-minute goal. And again, you can use your physician notes as well to reach your goal. But I do want to thank you all for watching the video and for all that you're doing for our patients, especially our heart failure patients, to try to keep them home and out of the hospital so that they can have a better quality of life. I do look forward to seeing how we do with the audits coming up, and I know that we will do a great job as we always do. Thank you guys so much.